What do you see on Capitol Hill to give you optimism that there will be a change?
Well, let me give you the good news first. The good news is that there is increased discussion about the crisis. And let me just touch on some of the aspects of the crisis. And I think I don't have to tell the American people, as they know it better than we do. For a start, in our nation, over 35 million Americans have no health insurance whatsoever. That means people get ill, they have an accident, they go to the hospital, they're going to be paying off those bills for God knows how long. In addition to that, you have another 50 million Americans who have only partial insurance. So they end up in the hospital, they say, boy, I'm covered, but what ends up happening is they're going to have to pay thousands of dollars for their health care bills. And what that means is, by the way, among other things, is that studies indicate that about 25% of American people hesitate, delay going to the doctor or the hospital because they're afraid of the bill. So what happens if you're sick and you delay going to the doctor? Guess what? You get sicker. The bill is larger. You may end up dying. Senior citizens are in very serious trouble. They are spending, despite Medicare, 18% of their incomes on health insurance, on health care needs. In my own state of Vermont, Blue Cross Blue Shield just is in the process of raising what they call Medicomp, which covers non-Medicare related health care needs by 24%. That's going on all over the country. In terms of prescription drugs, cost of prescription drugs is going off the wall. I don't know how many viewers know that the same prescription drugs that are manufactured in this country are sold in Canada, are sold in Europe far, far cheaper than they are in the United States, because we don't have a national health care system which stands up to the drug companies. So we're getting ripped off in that respect. Now, in addition, we have an infant mortality rate in this country which is 22nd in the world, 22nd in the world. Now, we used to be 23rd, but East Germany merged with West Germany, so we've moved up to 22nd. That is a national disgrace. Life expectancy, we're 12th in the world. That means there are 11 other countries where the people live longer. Now, having said all of that, people may say, well, the reason that we have so many uninsured people, the reason that infant mortality is so high, we're just not spending enough money. But obviously, that is not the answer. The fact of the matter is we are spending far, far, far more than any country on earth. And to me, what we have got to do, and in fact, I don't know, Lou, if you could show this. This is a graph which indicates the amount of money we spent over here. Canadians spend the second amount, and that's 40% less, and then you go on down. So we are spending far more than any other country on earth, and yet we're getting very little out of it. Clearly, I think the solution must be a movement toward a single-payer, universal, comprehensive health care, similar to what exists in Canada. People say that the Canadian system has problems. It does. But if we understand they are spending 40% less per capita than we are, I think by level funding healthcare at the present level of $756 billion, we can eliminate virtually all of those problems and have the best healthcare system in the world, where every man, woman, and child has all of the healthcare that they need without any out-of-pocket expense. And what we have got to do is move toward a single-payer system, which essentially says to the 1,500 private insurance companies, thank you, you've had your day, we can no longer afford to keep you. As you may recall, there was a study that just came out last week by the Government Accounting Office, the GAO, which suggested that if we move toward a single-payer system, we would save some $67 billion by eliminating all of the billing practices. What's going on in this country, you go to a hospital, you're getting billed, and you have Blue Cross, and you have Connecticut General, and you have Travelers. It is enormously confusing for the hospitals, for the doctors, and everyone's spending all of their time and money billing us. In Canada, you have a single payer. You walk into the hospital, you don't pay anything. Maybe the telephone bill is what they charge you. So the direction must be single payer, eliminating the private insurance companies, and also with the single payer, you can have some real cost containment. So that's what I am working very hard on in Congress. Now, the good news is there is more discussion than ever about that in Congress. The bad news is that I really don't believe that the Congress will have the courage to ultimately stand up to the insurance companies and the drug companies and the AMA and the big money health industry people. They have a lot of power. They put a lot of money into PACs. And I don't think that Congress, as it's presently constituted, can stand up to it. My hope is that all over America, by the millions, senior citizens, workers, middle-class people, all people, begin to say, hey, this system is no longer working. We need national health care. And basically say, I'm not voting for any member of Congress who is not prepared to support a single-payer, comprehensive universal national health care system.
Good evening.
I want to know what your philosophy of this is. I've read some of your work through the years, even before I knew you. If you were the czarina, something like single-payer health care, government-run payer, far lower administrative costs, that sort of thing, would be the Senator Warren prescription, would it not?
I think right now what we have to do, I'm serious about this, I think you've got to stay with what's possible. And I think what we're doing, and look at the dust-up around this, we really need to consolidate our gains around what we've got on this.
But you do support single-payer, do you not?
No, what I've got right
You've
now...
written repeatedly that you have you not?
I think you need to go back and take a look at it.
Most of the candidates on the Democratic side, all 24 of them, have either commented on Medicare for All or have signed on to it. But what does that really mean?
We got to keep moving this to a place where everybody is covered at the lowest possible cost. And there are a lot of different ways to get there.
The way I've proposed to do it is a kind of Medicare for all who want it. It's an option, a version of Medicare made available for people to buy into.
We have got to be focused on reducing and in some situations eliminating the cost.
The plan that I am supporting is Medicare for America, that guarantees that everyone who does not have care today is able to enroll in Medicare.
This system is not working. Clearly, we need to replace it with a popular system and expand Medicare to all. So I believe in a Medicare for all single-payer program.
The only one with a very distinct Medicare for All plan out there is Bernie Sanders. He wants to replace the entire healthcare system, including Medicare, and put a universal plan in place along the lines of Medicare for everybody. That's not going to happen.
I don't see this as a radical idea. I see it as an idea that more and more people want. Medicare today is a very popular program. It's the most popular health insurance program in the country. Let's expand it to everybody over a 4-year period.
How many people get their insurance from work, private insurance, right now? How many get it from private insurance? How many are willing to transition to what the senator says, a government-run system?
First of all, I don't think Bernie will be president. Don't tweet that because there'll be a lot of hate on my Twitter. But I don't think he's going to be the president.
We say to the private health insurance companies, whether you like it or not, the United States is going to join every other major country on earth and guarantee health care to all people as a right. And you can spend all of the money you want against us. We will have a Medicare for all single-payer system.
Does this only apply in the primaries, or will you carry this over to the general election or any other election you'll have going forward?
So this is for primaries. Look, I do not believe in unilateral disarmament. We need to win. We need to win in 2020. And when we hit 2020 and we're in a race against Donald Trump, when we're in a race for control of the Senate and control of the House and in control of the state houses and the governor's mansions, in all of those, the Republicans are going to be bringing a lot of money, a lot of power, a lot of dark money, a lot of super PACs, all to the fight. We play by the same rules. And in that one, I say we got to be all in.